the Honorable Minister of State for Health, Sarah Pendi, who has given us notice that there may be earthquakes in the health sector soon. The country director of CDC, representative of UNAIDS country director, representatives of implementing agencies, Bera Uganda executive Kikitinwa, who has, in my view, received very well and compliments from the Honorable Minister responsible for health. Our guests from near and far, invited guests, ladies and gentlemen. Let me take this opportunity to say how proud I am and happy I am to see such a cross-section of people who are on the front line, locally, regionally, and globally, to ensure better health care, better health delivery. This getting together, cross-fertilization of ideas on improving health care, I think is very, very crucial. And I believe that at the end of this conference, Uganda and the participants will be in a better position to perform even more in the area of healthcare delivery. I wish to also join my colleague, Sarah Pendi, in complimenting the good work by Ade Kikitinwa in her leadership of Bera Uganda. I have had the opportunity to visit her center at Mulago and also in the Rwenzoris in the field. And I was left with no doubt in my mind that she was providing good leadership. Of course, she's not an individual. She was working with the team and that team. And I thought that we as a country and as a region, we have something to learn from the experience that they were providing. Let me also stress how this gathering and her work demonstrates one major point of teamwork. One of the problems we have had in the health sector, and I believe in other areas of human endeavor, is fragmentation, scattered and unconnected participants. But when you look across here, you see researchers, you see development partners, you see health administrators, you see political leaders, you see a cross-section of people. And I do believe that the Bera Uganda programs has demonstrated that in order to achieve optimal success, you need to involve people in a coordinated manner, in teamwork, and that literally everybody matters in that team. So that recognition of teamwork, that cohesion of the people involved in combating disease and also in healthcare delivery, as demonstrated by Bera Uganda, in my view, is commendable, and I do believe that there is something to emulate by the rest of the country and the region. And I do believe that our figures, our indices in the health sector will significantly perform better if we adopted that type of model than the scattered type of arrangement that we have been having. So I salute the funders of the program, and I see that drug companies, are not going to the names, the drug companies, the many institutions at universities have pulled resources together, and again, this has added value in what is being done. I have been also very pleased to know that Caring Together project, and the name is also a good one, Caring Together. That's an important message, caring together, because it is that caring together that really brings wholesome management of a patient. So the name is a good name. It conveys a very good message. So Caring Together project, which we are here to learn about, used a unique approach which was based around a comprehensive district-led mentorship scheme aimed at empowering frontline health workers to deliver high-quality services. I understand that the final project results show, and Kate Tino has talked about the figures, but I repeat them because I think they are quite important. They show that there was 27% reduction in staff late arrivals, leading to 42% reduction in client waiting time. Quite often, people are far away from health centers, health facilities, especially in the rural areas. You spend a lot of time, go through problems of travel. Then, when you reach the station, the person you wanted to look after you is not available. This can cause even greater frustration. Mind you want to go early enough so that you are able to arrive home before it is dark. And perhaps the means of transport is not guaranteed. So patients have really great problems. And quite often we are more concerned about how we organize ourselves as health workers, but we often do not pay adequate attention to the challenges, the problems, the obstacles that patient goes through, that mother goes through in order to be able to reach a midwife at health center. So more attention, more focus, more understanding need to be given other than focusing on the usual issues, drugs, this and this, the problems and the challenges that the patient goes through. And I think they can be better understood by this team approach, by involving the political leaders, the social workers, and other related groups. There are other figures which are given, but as I said, I will not go into those. Caring Together project recognizes that everyone is capable of being a leader, no matter their cadre, and that each individual should take ownership of the care that they provide. This has created a culture of responsibility and accountability at all levels. This is really empowering the people, which in my view is a commendable point. Therefore, if we capitalize on resources already within facilities and bring out the full potential of individuals, this model should be easy to replicate throughout the healthcare system in our country. Uganda and the Ugandans present here That's with the people of Uganda who are here now. They are our guests. Ugandans who are here should be aware that on 23rd of June 2016, our president issued strategic guidelines and directives for the minimum program for Uganda to attain a middle income status. We are trying to be a middle income country. I'm glad that our guests from the first world, many of them. So we are trying to now move from being a third world country to a second world country. Perhaps we should jump the second step so that we go straight to but improving our health delivery systems may help us jump this middle step. In the guidelines, key tasks of the government were highlighted, and those specific for the health sector were also identified. The President further directed each sector to develop strategies for implementation of these directives and streamline the service delivery and operations of each sector. I do believe the experience we are getting in this program will help us actualize, meet the directives of the President to look afresh, to re-examine, and bring more workable, more effective health delivery systems. The key issues in the health sector, including, among others, theft and stockouts of medicines, neglect of duty and absenteeism, poor governance, corruption, poor service delivery. So there are many issues to tackle. I suppose we'll have to prioritize them and see how to tackle them. Otherwise, it's a challenge. And I do believe that under ADE's leadership, you'll help government in focusing on tackling these challenges that I'm talking about. This leadership summit that we are having, therefore, given the challenges I've talked about, is timely because I do expect that it will help government to move forward. I urge you to generate practical solutions to some of the challenges identified above. We are more than happy to receive ideas that government can consider to generate a policy direction for the health sector. So in a way, the timing is excellent because it's coming when the government is looking at new ways and new means and new solutions for tackling our health delivery challenges. I'm glad the Honorable Minister of Health was talking of now standards in pediatric care. I think that every sector now should be looking at improving standards of care, quality of care. As government, we are particularly concerned about the human resource for health. How can we curb organized absenteeism of health workers and negligence of duty? Absenteeism of health workers cheats government of up to 40% of their time of employment. This malpractice affects the quality of patient care and destroys teamwork, and of course undermines confidence in the health sector, health services, and health institutions, because it will mean patients will come and find there is nobody ready to respond to them when health workers are not available. Staff absenteeism arises from late coming on duty and early departure from duty, negligence of duty, and dual employment or practice. Sometimes it's not dual employment, or practice, sometimes it is multiple, or it is, if in an attempt to meet the challenges of survival, health workers, like many other people, endeavor to work in too many places. And it's not humanly possible to overdivide yourself in that type of situation. And indeed, this also undermines the quality of health care. And this is why government has decided to supplement the remuneration of health workers. And we do expect that this will help them be able to concentrate on their work in terms of patient care, both in terms of the time they spend and also in terms of the concentration they give and attention they give to the patients. May I urge this meeting to come up again with practical solutions that the Minister of Health can adopt to motivate our workforce and also improve its vigilance in enforcing statutory provisions on human resource management. I'm therefore glad that Baylor Uganda, in collaboration with international partners, PayPal, Janssen Pharmaceuticals, NV, Ralph and Lewis, and the cross-sector leadership exchange have made health leadership a reality in the country. Thank you for the contribution that you are making to the health sector strengthening in the country. As leader of government business, I will not hesitate to recommend that you, our partners, should continue with the collaboration with Baylor Uganda. And again, out of this interaction, I wish to encourage others to join the support that this initiative has generated. So in a way, I'm reinforcing what Minister Opendi said, that when you see something good, it needs to be supported, it needs to be strengthened, it needs to be reinforced. Quite often, good work is done, but it remains truncated, it remains in different domains. Good drugs may be made, but they may be too expensive. They may not reach people. Excellent drug. But number two, great research may be done, but a research paper may be published and things may end there. So, it is the holistic, it is the integration, it is linking up things for the service of the patient that we are really talking about. So government, as I have said, will now be waiting for your ideas and recommendations, which we shall be happy to include in the Ministry of Health policy paper, because I'm convinced that with all these brains, human resources, you will generate smart. Smart is sometimes interpreted in many ways, but here I mean specific, measurable, attainable, realistic, and timely approach to improve leadership among our health workers. Last but not least, I also want to ask our friends who are here, especially from outside the country, to also spend some time so that you can learn the country better. Actually, apart from touring the country, you'll also be seeing some of the issues that may be contributing to the disease burden that we have in our country. I want to take this opportunity once again to welcome you, friends, for sparing your time to come and join us in Uganda. I'm very happy to see you, and I'm happy to see the pillars of the struggle for better health care in Uganda, and the name of Noreen Kareba has already been made. Cotino has been made. There are many names here I can see of people who have been at the vanguard of improving health services in our country. I salute you. I encourage you to remain good examples, to be emulated, especially by the younger generation coming up to the health sector. They will have role models to emulate. Government will continue to do whatever it can to ensure that the great work being done by the health sector and by health workers is indeed supported. It's therefore my great pleasure to declare this summit officially open.